Good morning, everybody. This is Dr. Marianne Pinkston and The Better Life with Dr. Pinkston. And I am bringing one of my dear friends and comrades that I admire so much and respected for, I don't know, Jim, what has it been, like 18, almost 20 years now? And we're getting older, and I think we're getting prettier, though. I think
it's been a minute.
I think it's working out all right for both of us. But Jim LaValle is on with me today. And I wanted to bring to light here, no pun intended, a topic that I think everybody's asking a lot of questions about. I'm asking a lot of questions about. You know, I have an inflammatory disorder and I don't want to age either. I mean, I want to stay young forever. So red light therapy, that's what we're all trying to do, right? So red light therapy. And you are one of my go-tos for all of the wonderful advice on anti-aging and metabolic health and all. And so give us an update on things for you, first of all. What's going on in your world and new and wonderful?
Oh, I mean, there's just so much happening right now. So it won't be called Metabolic Code Book. It's got to get, a new title to it, but it's basically Metabolic Code 2.0.
Yeah,
that's an update on all the chemistry of what we learned over the last 20 years. Although the last book still seems current when people read it, they go, wow, this is pretty much right on, but kind of taking things into the next 20 years, probably be the my opus book.
Good.
And then we've got a book on blood tests for performance. That is in the editorial.
All right.
Trying to finish up my second edition of Your Blood Never Lies.
There you go.
So I got a lot of book stuff happening. Obviously, the Instagram's popping, working with my son on that. So that's great.
Gotcha.
And, obviously we're real busy with Lifetime and putting together the longevity centers there, which include red light therapy. So, staying pretty busy. Got a lot of work going on the liposomal tableting technology on the pharmaceutical side. So I think that's about it. Trying to work out, trying to stay fit,
And you add anything else. Oh my gosh, the busiest person I've ever known, right here, sitting right in front of you there. Well, good. Well, and the Instagram is The Real Jim LaValle, in case anybody wants to go look you up. But I will have that on my website so that people can hook up. And then as soon as your books come out, I'm going to list those too and make sure that people have access. Great book. Great book. So, well, great. All right. So jumping in, red light therapy, kind of what is it and why is it becoming so popular?
Yeah. So red light therapy is the other term for it is photobiomodulation, right? So light waves, right?
Yes.
And then how it modulates tissues when you're in particularly a red light bed.
Yeah.
And so it really, red light therapy is interesting because there's different wavelengths of light, right?
Yes.
So there's a couple different ones. I mean, I'm just to say it right out front in case somebody cuts out of here quick is, you want to have two wavelengths. So two wavelengths, one should be in like the mid 600s and the other one in the mid 800s. So if you're looking at getting a red light therapy, those are the two recommended frequencies. And some people, it's got to be 620 and 840.
Right.
800, 840, 600 to 650, you're going to be okay.
Good.
So red light therapy has a variety of benefits. So the first thing is if they're shorter wavelengths, so like the 600s, that's more oriented at your skin, stimulating collagen. So, you talked about wanting to age better. So if you have you get crepey skin on your legs and your hair, on your arms as you're getting older, yuck. Obviously, you can do things like use OSO1 cream, which is a peptide that's showing up to be really good for crepey skin.
Oh, great.
Why not do that and add red light therapy? So red light therapy stimulates collagen synthesis. So when you use red light therapy and those short wavelengths, the whole purpose of that is to stimulate your collagen production in your skin. Of course, improved collagen production is going to be less lines, less wrinkles, less crepiness.
Yep.
So you'll see people get with a red light face mask to use that for their face. And then you can get in a whole body red light therapy. Now, typically, a whole body red light therapy, if you're getting in one of those clamshells, you would want to think about covering your eyes. You don't want to have your eyes wide open when you're doing it.
Right.
Otherwise, I know I got one of those red light therapy, almost like mat beds, where it's two red light, basically blankets that you can cover yourself. So, I mean, it's pretty interesting, everything it does. So one thing that it does is it stimulates nitric oxide production. Beautiful. So you get better circulation into your tissues. The other one that's pretty interesting is that it helps to stimulate ATP production. So basically, you're going to make more energy. Pretty interesting. Yep. And then the third piece of it, so if you want to think about the three big areas of benefit, you have skin. Why is nitric oxide important? Well, if you ever listen to Nathan Bryan, and a lot of people have listened to Nathan and his work on nitric oxide, as you get older, you lose nitric oxide production. So being able to stimulate your tissues to make nitric oxide, fantastic. Obviously, there's nutrients you can take for that. And then ATP production, look, as we get older, our mitochondria just don't function like they used to, and that's going to make you more fatigued, and you're going to make more lactic acid. You're going to get more sore after a workout. Hence, one of the other benefits of this, which I know we'll get to, is great for post-exercise soreness, muscle aches, joint aches. Really nice for that. And then the other piece is it helps to repair your cells. So literally you get an improvement at the cellular level on repair processes, which makes sense because you can't really boost your ATP without repairing your mitochondria.
Absolutely.
So that's a real quick down and dirty. That was a lot of info right there.
But it's great.
Those are big areas when you think about aging. So I think about aging gracefully, right? Like I'm still 65. Nitric oxide, essential, because what that means for the folks out there is that your blood vessels dilate better and you're going to get more blood flow deeper into your tissues.
Yes.
And why that's important is you're carrying oxygen deeper into your tissues, which is awesome. And that's going to also mean you can get rid of the byproducts of your metabolism much more easily, the better your microcapillaries are expanding.
Yes.
So that's huge. And it goes without saying, if you have improved ATP synthesis and you have improved mitochondrial function, mitochondria is the basis of all health, right? So when you hear about mitochondrial health, and there's some cool tests that you can do for that now, but it really has to do with your resiliency because you need your mitochondria pumping that ATP out, even when you get a cold or flu.
Absolutely.
So energy for working out, energy for daily life. And remember, all chronic degenerative diseases have a mitochondrial failure component to some extent or another. So that's kind of the quick down and dirty to get us all excited about why red light therapy matters.
Absolutely. And it does. And so I've been using it a lot lately in the blanket form that you discussed. And so I know that there are, like you mentioned, the face mask, but panels. Some people set something on their desk or, kind of build a room. Or so what is the best way to do it?
I think I'm a fan of using the blanket because it's whole body and then you can get by on less time and get more effect.
Yeah.
So, you think about how much you should do it.
Right.
It varies, but honestly, there's a kind of a ramp up phase and then there's the maintenance phase.
Sure. Okay.
And, the other piece that I think is important is they've even shown that it can improve brain health. Now, obviously those wavelengths are a little bit higher, but at the same time, this thought of using light as therapy, it only makes
Mhm.
sense. Think of the power of just getting in the
Sure.
sunlight in the
Sure.
morning and activating your circadian rhythm, right?
Thank you. Thank you. Yes. Lately, I've been getting out in the, kind of the first light morning sun, that has changed my life as far as circadian rhythm. Get up easier, my energy's better. And so, yeah, I believe in that.
Well, you're out in the tundra getting all that great morning sun. I mean,
Exactly.
it's like, yeah, you, it's not even fair. You could bottle that and send it off,
Sell it.
right?
I will. You bet.
It's pretty amazing.
Idea.
So the thing that like just to keep in mind, why do you want both of those types of
Yes.
frequencies? Remember the near infrared, or like the 700 to 1100 range. I was talking about getting in that
Right.
800-ish range.
Yep.
That goes deeper into your tissues.
Okay. Yep.
So that's the one that really helps with like decreasing inflammation in the muscles, helping with reducing inflammatory signaling, even related to your nerves.
Yep.
And so, you activate the mitochondria, very cool, but it also helps with just activating your intracellular calcium channels and then helping to kind of regulate
Right.
oxidative reduction reactions. So pretty important. I think you should do both. Obviously, the older you get and you're exercising, you're active. I mean, yesterday I was doing leaves and all kinds of stuff. And, I got in at the end of that 4-hour journey and I was
Yeah.
like, wow, my back's a little sore. Maybe I'm going to lay on that red light bed.
Amen.
Took care of it. So,
Yeah.
I mean, I was pretty excited about that. And, you can I think it's real important to understand timing.
Yeah.
Like how should you use
Let's do
it?
that.
So, I mean, we
Yeah.
can go through all the big things that relate to muscle and what it is good for, what it isn't good for.
Right.
But honestly, you start out probably 4 to 5 times a week.
Okay. Yeah.
Typically, usually 15 minutes is adequate, especially if you're laying on a whole body, 15 to 20 minutes.
Yep.
And then, at maintenance, you can go down to 3 times a week unless you're
Wow.
working on some specific other issues. But typically it'll, 3 times a week is usually enough once you achieve kind of, hey, I'm not sore so much. Gee, my skin has changed. It's really improved.
Mhm.
You can bring that amount of time down, or the frequency that you do it. So that part is
Makes it easier.
really important. And look, this is like tendinopathies.
Yeah.
I mean, fibromyalgia. This is like a
Huge
game
for that.
changer.
Absolutely.
Game changer.
Absolutely.
It won't fix a tear.
Right.
So like if you have a tear, a tear is a tear.
Right.
Osteoarthritis, where you're getting bone on bone,
Yep.
it's not going to fix that, but will you help to alleviate the inflammation as a result of that?
Yep.
You'll probably notice less pain.
Right.
But more and more people are exercising, as you and I are absolutely, I would say addicts to exercise.
Absolutely. Thank you.
We love our exercise.
Call it what it is.
And it really, it's even been shown to improve grip strength.
Wow. Nice.
Increase speed.
Yeah.
I mean, it literally has physical performance attributes to it, in addition to immunoregulating. So when we talked about skin, it's no little thing. That immune regulation that's occurring and collagen synthesis is occurring helps in skin conditions like psoriasis. So you're seeing people using it on the immune side and improving that quality of skin.
Absolutely.
And then, I mean, I don't want to, once again, in general, I find a lot of people are overtraining nowadays. Like they're spending, it's hard to believe. I know we hear you can't overtrain, you can only under recover. Right. So there's the advocates that are like, hey, you just can't overtrain. You just don't recover good enough. Well, this really helps on that recovery cycle. And why that's so important is you reduce your risk of injury.
Right.
If you get those inflammatory compounds out of the tissue and the achiness and the lactic acid and the oxidative stress, you move that around quicker, you're going to recover quicker. You're going to create less damage, or getting that delayed onset muscle soreness, or DOMS, as it's known as. You can clear that stuff out quicker. And I think those are really important, especially as you're trying to stay active as you age, because for both of us, we know,
Yep.
Muscle's the currency of longevity.
Absolutely.
The more you keep that muscle on, the better off you're going to be.
Yep.
So those are some of the big areas that I think are important.
Just about everything, really. And so, is there a situation, right? Almost. It's just like the miracle. And so, oh my gosh, I tell people, no, not any one thing is a miracle, but it's nice to, combine these factors with other things. And so, is there something that you combine red light therapy with, maybe from a supplement aspect or, on the inflammatory and on the collagen side?
Sure. So the one thing I'll mention is if you're on medications that would make you photosensitive, you should be really careful.
Gotcha.
So, tetracyclines, other drug therapies may make you more photosensitive. So you should just be aware of that. Make sure if you're on medication, look up if any of them cause photosensitivity, because that could create a negative reaction. So that's a big one.
Yes.
So things that you could take. So one, if you're interested in mitochondrial repair, right, or mitochondrial function, nicotinamide riboside or Niagen is, well proven to help improve NAD levels and therefore improve mitochondrial capacity. Obviously, the go-to standards on that are things like CoQ10. If you're looking at a peptide, recently approved drug is a peptide called SS31, which is a mitochondrial peptide.
Nice.
Now, you can look at, there's key things about mitochondria you can't avoid. You need B1, you need B2, right? You kind of need all the B vitamins to really help that. And the other one that people don't recognize is magnesium.
Absolutely.
Magnesium helps mitochondrial production of ATP. So you've got those key nutrients. The other one I would say, if you're thinking about mitochondrial health, is phospholipids. So phosphatidylcholine, phosphatidylserine. You think of the phospholipids because they help keep the cell membrane intact and the mitochondrial membrane intact. Because what happens when your mitochondria get damaged, you start getting electrons leaking out of there, and that just creates free radical damage. So you want to repair all that. And the PQQ, pyroquinolone quinone, is a mitochondrial catalyst. It's a dietary supplement. So vitamin C, of course. But then we get on to collagen. So collagen, copper peptide is amazing. You can use that topically. Really good. Obviously, you take collagen. I'm onto this new collagen that's about to hit the market. That's a fish peptide derived collagen. So they're polypeptides that are derived from, basically enzymatically treating the byproducts of the salmon industry. And there's some really good evidence of how effective the collagen is utilized versus kind of like the traditional, collagen peptides. When you're taking collagen, always good to make sure you're taking vitamin C. You gotta make sure you got adequate vitamin D for skin integrity.
Absolutely.
And then probably the biggest thing for the skin is just making sure your microbiome is doing well.
Gut health, yes.
Gut health's at the center of. Like I've done a lot of lectures at the dermatology conferences lately that relate to that whole gut skin interaction. Finally recognizing that hey, it's something on the inside causing problems on the outside, and that's why that's occurring. And so those are the key things that I like to recommend. What do you have any other ones you like to recommend?
I don't know. Lately, there's been a lot of talk about methylene blue. So what do you think about methylene blue and mitochondria?
I really like methylene blue. Yeah, it's great. I would say the only thing I would say on methylene blue, it's probably good to go on and go off of it. Unless you're doing like active cancer treatment where they're using methylene blue to activate or increase the efficacy of the treatment that you're doing. Probably a good idea. Like if you fly, taking methylene blue, good idea to take it before you fly, right? So that's good. And then of course, doing it chronically is really good. I tend to have people do it for maybe, 4 to 8 weeks on and 4 weeks off, just because there's some thought that you need to take breaks from methylene blue. So I love methylene blue. I mean, I think it's obviously you got to get the right kind of methylene blue. You can't go buy fish food, or aquarium tank methylene blue.
Exactly.
You need the USP grade methylene blue, which
Thank
I know
you.
that.
Yeah.
I'm telling
our audience. Thank you. Yes. You'll buy anything.
Don't squirt the antioxidant from the fish tank into you.
Oh my goodness, absolutely. I think that's one of the bigger things that I use. And of course, I check everybody's methylation. So you mentioned the B's though, and all the methylfolate, methyl B12 and whatnot. So yeah, that's pretty much my list as well. And I know collagen, taking collagen is a big one. A lot of people add it to their shakes or, take the
Sure.
tablets. And I know there's all sorts of grades of good on that one too. And of course, you've always got the latest and greatest before everybody else gets it. But what's a good version of it that you like to tell, maybe your patients metabolic code?
Type 2, type 4. I don't have one metabolic code. I mean, type 2 collagen, type 4 collagen, those are the ones that are going to be good. And everybody's like, oh, you need to use fish. No, you need chicken trachea. No, I think in general, when you think of collagen, what do you need to make good collagen? Well, there's 2 amino acids you need mainly, hydroxyproline and proline, which are very rich in collagen. So if why those are important, they help with what's called the cross-linking of your fibers of your skin and in order to make the integrity of your skin.
Yeah.
So that, along with vitamin C, it's really good to take if you're doing collagen, either if you're doing it in a smoothie, take a vitamin C capsule with it. And that's going to help with recovery from exercise.
Yeah.
B, that's going to help with the incorporation of the hydroxyproline and proline. So
gotcha.
Pretty solid when you start taking that and doing red light therapy, adding the antioxidant benefits. You can really see significant differences in your skin. Now, the thing that everybody says related to red light therapy, and I think taking supplements helps this, it's about consistency.
Absolutely.
And that's probably the number one thing that I think, people get into doing a regimen and then they kind of tail off and they're not doing it. It's like, why isn't my skin better? Well, you haven't worn the mask in a week. It's about creating a regimen. And you got to pick and choose the regiments, because before you know it, you're regimenting all day long and you're not getting to enjoy your life.
This is true.
I'm kind of big on, hey, we should, pick out the things. But I got to tell you, I think red light therapy is at the top of the, is one of the top things that you can do.
Absolutely.
Without a doubt.
Yeah, absolutely. And so on that note too, you mentioned about lab tests for mitochondrial health. I know a lot of doctors don't do, lab testing or even sometimes recognize that there's much about mitochondrial health, but what kind of testing do you usually recommend?
Well, if you want to really get the gold standard test, which wouldn't feel too good, that would be a punch biopsy of your muscle. I don't know if we want to do that.
Run the other way.
But interestingly, researchers at University of California, San Diego, Hemel Patel, actually, they developed a finger prick that tests for mitochondrial function, 17 different categories of mitochondrial function.
From a finger stick.
It's pretty interesting. Yeah, it's called the ME screen, ME screen.
Okay.
And it's really interesting because it gives you kind of how much electron leakage is going on, what's the health of or status of the mitochondria.
Yeah.
It really gives you a complete picture of, where is your mitochondrial status. And I think that's a real innovation that's happened, just came out this year.
Wow.
So
nice.
it's a very interesting and new test that I think is, I think it's going to be one of those things that are invaluable as you move forward with, hey, am I really getting somebody well?
Yeah.
Because obviously if the healthier the mitochondria in general, the healthier you're going to be.
Absolutely.
I still would not look at that as, oh, that's the test that you can, hey, put your, that's how you true up your health.
Sure.
Still got to look at glucose, still got to look at lipids, you still got to look at inflammatory markers in your bloodstream, because sometimes those things are shifting and are causing a problem before it's distilling down into really damaging the mitochondria. So it depends how good you feel or how ill you feel.
Yeah, I'm glad you brought that up, because like I said earlier, there's no one thing that's a miracle. And most people hear the latest and greatest will jump on that bandwagon, forgetting that it's a head to toe issue. There are many, many things that you have to do together to, encompass good health. And so is there anything that, is there any way that red light therapy, other than, the medicines that you're taking and photosensitive and whatnot, is there any reason why you wouldn't do it? Is there any harm?
I mean, I think in general, it's safe. I mean, I think if you have a specific condition, medical condition, and you're concerned, you can always, look it up. You can ask your doc. You can find out if there's an issue. But my biggest concern is kind of that red flag of, you're on medications and you don't realize it's a photobiomodulating, issue.
Right.
You got to be really careful, because you can really irritate your skin in a big way.
Absolutely. Yeah. Well, good. That's, I haven't really found any reason for people not to. I find sometimes though that, people, when they first start it, sometimes can feel worse before they feel better. So,
well, that makes sense though, right?
Right. Kind of detoxify and get some of the junk out.
You're getting all that lactic acid out of your tissues. I mean, you probably wouldn't do it. I mean, if we get real specific, you probably wouldn't do it with active skin cancer.
Right.
It'd be pretty irritated, right?
Yeah.
You wouldn't want red light therapy, like where you're getting it on your eyes, because it might trigger, like if you're epileptic, how blinking red lights or red light therapies could trigger something. It's not that it's bad for epilepsy. It's just that might be a case.
Sure.
Maybe lupus. I don't, it's a maybe. But, I think those would be the biggest things, because I actually think of, immunotherapies like autoimmunity. Like, why wouldn't you want to use this? Because you're regulating, you're regulating the mitochondria. I don't really see how that could be an issue. But if you're really like, hey, there's the biggest concerns. Like if you had an active skin cancer, you should probably check in on that for sure.
Yep.
And then obviously do a little bit of research on whether or not, any other conditions might be a problem if you have one. But I have not seen anything that's real significant.
Absolutely. And so I know it can help kind of underlying, like we mentioned, sitting out in the sunlight, circadian rhythm or whatnot. I find people sleep a lot better when they use red light therapy too. So I find a circadian help. And I think that's underlying mitochondrial, but it's, even help there as well.
Well, that's interesting, because I did a really odd thing. I hadn't been doing barbell squats in a while. And I decided I'm going to do barbell squats. I'm going to elevate my feet. I'm going to go down real deep. And all of a sudden I was into my fourth set of them, which, I hadn't done them in a long time. Now, this would be classified as stupid. But I woke up in the middle of the night and I was literally absolutely sore and achy and tight. And I went in my red light bed. I went in there and I laid down for 30 minutes, turned it on, and then I would jump back in bed, fell asleep.
Yeah.
Next day I was totally clear.
Wow. Nice.
Totally clear.
Nice. Well, good. Well, that is helpful. The soreness and, like you say, the lactic acid and all that is middle of the night. I can't imagine you dragging out your red light therapy blanket, but that is perfect. You should.
Well, it's set up on my bed. So
good. As your bedspread, maybe. Yeah. Well, awesome.
Absolutely.
For those watching, don't worry. Jim is still here. We're talking, but this is really a great coverage of red light therapy. Again, lots of benefits. no major reasons why you shouldn't do it. There are a few, so always check with your provider. We always want to be cautious about those things individually. But anything else, Jim? What else can you think of that we may have left out? I can't think of much. You've really covered this very well. Thank you.
Yeah, no, I mean, I thought, I wanted to come in prepared and kind of give people hey, here's the 2 light therapy ranges. Remember, if you're listening, 600s, 800s, that's kind of the one that you can't go wrong on.
Absolutely.
And then just don't overdo it.
Right.
Those are the 2 B's. And then all the other things that I had mentioned, make it happen.
Yep.
Right? You can get a panel. I like the bed personally, but you can get panels. There's a lot of ways that you can incorporate red light therapy.
Absolutely. Is there now, that is something too, there are a lot of different brands of them. We don't really market or we're not paid by anybody to recommend brands or anything, but is there one, because I know there should be some concern. There may be some that aren't very good out there and you should be cautious about, but is there any 1 or 2 brands that you would recommend?
Magellan, Magelin is kind of a nice brand.
Yep.
There's a variety of the panels that are out there, but I mean, I've been referring people to Magellan just because price is really reasonable.
Good.
And they work great and are in the right fields of light. So
good. All right.
Good to combine this even with if you're doing infrared sauna, right? Nice combination. If you do sauna with it, very good.
Gosh. Yeah, absolutely. And those are the things that you can access at home, or I know I have a trainer. My trainer Sonia has an infrared sauna, so we do that right after exercise, and so lots of great combinations there. So good. I mean, the rundown is we know the ranges to get, how to do it, how long to stay in it, and work up to it. Great list of benefits and risks, pros and cons, and supplements and labs and things like that. Jim, I think you've covered it all as usual. I really appreciate it. Any final words for everybody out there? And then one more thought about how to find you.
The Real Jim LaValle on Instagram is the easiest. Obviously, JimLaValle.com. They can look up Metabolic Code if they'd like, metaboliccode.com.
Yep.
And of course, obviously, I'm Chief Science Officer at Lifetime, so they got a whole bunch of stuff up about me kind of being printed and getting out there into the media now.
Yes.
That's about it. Final thought is take the next step. Think of one thing that you are doing in your habits that is not good for your health.
Correct.
Try to change it.
Absolutely. And 1 a week, just take 1 habit a week and start that change. But that's wonderful advice. As always, Jim, thank you. It's always a pleasure to have you on and an honor. And if anybody has any questions, we've got some previous shows too. Go to drpbetterlife.com. Check those out. And I think that's it. Hopefully we'll have you on again. And I hope everybody has a fantastic week. Please take care of each other out there.